Hi, everyone. As folks are rolling in, we'll get started here. Welcome to day two of the AI for Global Health webinar series. My name is Ashna. I'm a PhD student based at the Global Health Network. I study health data science and I have a keen interest in ethics. So I'm really excited for the webinar today, which is titled Navigating Legal Policies, Frameworks and Policies in Data Science and AI in Health. So before we get started and listen from our amazing panel of speakers, I'll just explain a few housekeeping rules. This workshop is being recorded and will be shared on our online platform. It'll be held in English, and simultaneous translation is being provided in Spanish, Portuguese, and French. If you are listening to it in English, we recommend maintaining the original audio as is, because all the presentations are in English. However, if you would like to change the language to Spanish, Portuguese, or French, you'll see a little interpretation icon like this at the bottom of your Zoom toolbar. So go ahead and click that and you can pick what language you prefer to listen to. Due to the number of participants today, your camera is off and your microphone is muted. Please use the chat feature for introductions as you are now and to report any issues. And please use the Q&A feature, which is also located on your bottom toolbar beside the chat, to post your questions as speakers are speaking. We'll try to get through as many of those as we can after each presentation, but speakers will also be heading in there to answer your questions right within the Q&A. This is a quick snapshot just to show who is joining us from around the world today. You can see we have a lot of participants from a lot of different countries, which is very exciting. I've already introduced myself. I'll briefly introduce our three fantastic speakers for today. The first one you will hear from is Federica Lucivero, who's a senior researcher in ethics and data at the ETHOC Center, the Nuffield Department of Population Health here at the University of Oxford. Then you'll be hearing from Evangelina Baca, who is a responsible AI manager at Health AI and a lecturer at the Institute for Information Service Science, the University of Geneva in Switzerland. And lastly, we'll hear from Henry Nuno Mensa, who is part of the Responsible Artificial Intelligence Lab at the Kwame, I'm going to mispronounce this, I apologize, at the Kwame Nkrumah University of Science and Technology in Ghana. The agenda today is we have a quick round of welcome and introductions, which we're doing now, and then we'll jump into talking about the ethics of designing mobile AI-enabled health interventions. We'll discuss the impact of international law and policies or national regulations for the AI interventions in health. We'll talk about the focus framework for health data management, and finally, we'll have some closing remarks. Quick note on certification. So you can get certified if you attend these webinar series, but there are two important requirements here. You have to complete the TGHN workshop feedback survey, which we'll talk about after the presentations, and you have to have attended 80% of the workshops. So the code and link to the survey will be shared at the end of this session. Please include the title of this event and the code provided when requested. So your certificate will be automatically emailed to you within 1 month, so a few weeks from today. And if you would like more information about how this works, there's a little link at the bottom of the slide that you can visit. And just to quickly reiterate some learning objectives from today. So today we are hoping to understand ethical challenges in the design, implementation, and impact of AI-based health interventions. We hope to learn about the impact of international laws and policies on national regulations with the focus on WHO recommendations. We're also hoping to understand the ethical implications of managing health data using AI. We're also hoping to identify strategies to ensure inclusivity and fairness in AI-driven health data management systems. So this is a very wide range and very interesting topics we'll be covering today. So with that, I'll stop sharing my screen and I'll hand it to our first speaker, Federica.
Thank you, Ashna. Just nod if you can hear me well. Yes?
Yes, we can hear you
Right.
well. Thank you.
Thank you. Thank you for the invitation. And I should say it's truly exciting to speak to really such a kind of global audience. Um, so um, let me start by sharing my presentation, and I hope you can see it well. So yeah. I am an ethicist, a philosopher by background. And what I want to do today is to take you to a like short journey about like thinking about the ethical challenges and problems around artificial intelligence interventions for global health. So for those of you who were here last year, we have learned, last week, we have learned about how what AI has to offer for global health, and we discussed technical challenges and solutions. But again, what are the ethical challenges? And before we start, I like to just to clarify and make sure that we are all on the same page when we're thinking about ethics of AI. So my question for you is what comes to your mind when you think about ethics of research using AI? And you can use the chat function for that. I think it would be interesting to have an overview of the different answers. And the reason why I think it's interesting, I'll keep an eye on it. Difficult to move between the screens. But the reason why it's interesting to think about that is that I'm pretty sure that every one of you will probably have like a different answer to this question. And what I expect is that some people will think about ethics as something that has to do with what is right and what is wrong, what's the right decision or what is a wrong decision. Something will think about like principles and fairness and justice. People will have like clear idea what this. Some people will have like specific ideas about what these principles are about, if they are about respect or beneficence or maleficence. And yes, one of the answers is about ethical review and ethical clearance, which is really, what's at the bottom now of the slides, which is really ethics is about research ethics, is about international review boards, is about sometimes about paperwork. And sometimes it's a bit unclear how ethics how ethics is different from regulatory and legal frameworks. So what you see, ethics is something in between what is kind of this kind of ethereal place where there are kind of principles, a little bit of abstract and some ideas of good and principles. And this is interesting in this last answer is something about standards and principles. So the second row is about something that is procedural. It's about like more like standards again. And what I like to do in this talk is really to go beyond this kind of ethereal versus procedural distinction and really explore the ethical questions, the ethical challenges and questions through some concrete examples. And for the sake of clarity, this is a kind of a working definition that we can use ethics as an analysis of moral principles and reasons that guide how one ought to behave in a particular situation or in general. And when I talk about moral principles, people have been talking about moral principles as autonomy, for example, or greatest good for the greatest number of people, saying, well, something is ethical if it always enhances or promotes people autonomy, or if it always enhances or promotes the greatest good for the greatest number of people. In this talk, in this session, I will be agnostic on what these moral principles are, but I will be focusing on a specific situations where we are asked to think about what is good or bad decision, or right or wrong. And it's basically the choices that you make when you are developing AI health interventions. So we'll be like specific on that. So the objectives for these sessions will be to introduce ethical challenges of AI-enabled health interventions, to take the time to really understand what are the moral issues at the stake with these broader challenges. And I will be using also examples from projects presented last week. Again, for those who were there, I think gives like a nice sense of continuity. And it helps to kind of ground some of these questions like specific projects. So the first issues and challenge I would like to discuss is the issue of black boxes, unfair treatment, and transparency. These are like issues that you often hear about, and I know that the speakers who come after me will discuss also some solutions and some ways to tackle these issues. I'm not gonna offer you any solution in this first session. I will be like really exploring what is the problem at stake, so that when you think and you hear about solutions offered by or tools offered by the other speakers, you get a sense of really what is at the stake. So why do we talk about black boxes in the context of AI? Probably you are all aware of it, but just as a reminder, AI is a black box where, I mean, it's often associated to a black box where it is unclear how decisions are made. So we know what inputs go in, we know what comes out in terms of the decisions, but we don't really know what happens inside. And just to give you an example of it, there is this case of this man who was violently assaulted and requires surgery. Together with his partner, he had health insurance, but when they tried to settle their bill, the claim was rejected because the computer program, the algorithm had red flagged the case. Why was the case red flagged? And was this decision legitimate? Well, there were some common indicators of fraud. For example, the policy was taken just like a few days before the accident, and the two were not married, and the man was prescribed some opioids after the accident. But what happened is that the partner of this man is a highly respected New York professor in policy, focusing, working, doing research on AI. So she really knew how the system worked, and she could spend hours and hours arguing with insurance company officials until the claim and decision was reversed. Now, why am I using this case, which is not very specific I mean, it is specific to health, but I think it's a good case to show why people worried about this black box. So what is the ethical problem with black boxes? If the reasoning behind decisions is not accessible, it cannot be challenged. And also challenging decisions may take a long time, much money or skills that not everyone has. So the outcome might be really discriminatory and unfair, not only because some mistakes can be made, which can be made in many contexts, also human contexts, but the problem is that it takes very specific skills to challenge this decision. These skills that may not be even that even the persons who have to make the decision or have to revert a decision sometimes have. So why for these reasons, people talk about transparency as a key principle that AI systems should have. So an AI system should be transparent, particularly about what went into the algorithm recommendations. And people talk about explainability. So the reasoning behind the outcome of a decision should be made clear. And I'm sure you are mostly aware of it. One thing that I just want to point your attention on is that when we talk about transparency, this is it's a relational concept. So what is transparent? It's not everything is not transparent to everyone. And it could be transparent to different people at different levels. So, for example, users must be able to see how the service works, evaluate its functionality, and comprehend its strengths and limitations. So the question is, who is the users, and whether whatever is in place to make the system transparent is transparent to those specific users. And just to give you an example of how this issue of transparency, has emerged as I saw it from last week's session, and I'm referring here to Abhishek Dasgupta's work and global health work on generative AI for outbreak analysis. What I found really for those who are not here, the question is, how do we make outbreak analysis accessible to a wider audience? And then they developed this data set that answers questions about infectious diseases using this databases, right? What I found really interesting, if you look at the screenshot that Abhishek presented last week, is how they make it really clear how you know what is the reasoning that the system is using. So if you think about very differently, for example, if you think about how off the shelf LLM and a chat works. So, for example, here it says, I use this question. So when you ask a question, how many people have died from Ebola across all outbreaks? The system says, I use this query, and it gives you like exactly the type of query that it asks. Um, and and this is important. This is one way of really addressing these issues of transparency. These systems are not thought because we can talk about explainability and the fact, oh yes, there is a file, there is a way to go back and to understand the reasoning. But here it's very explicit. And why it's very explicit? Because this specific tool is done for a wider audience who might not have the skills to actually go and read like very complex codes and documents. So, or the time as well. So it's a very clear signal of how the query is addressed, and it does not hide the reasoning. It brings it to the awareness of the user, and in this way, it addresses these issues, for example, of transparency in a very apparently like simple but also very effective way. Let's move and think about like a different type of challenge, maybe not so different, but when people talk about fairness and biases. And I know you all know about biases, and I just want to focus on what I mean by fairness. Usually we refer to the equitable treatment of individuals or groups of individuals by an AI system. And in the picture you see a pair of glasses because what is often was often believed was that, especially like a few years ago, was that when properly calibrated, AI can assist humans in making fairer choices, countering human biases, and promoting inclusivity. So you get this pair of glasses, which is really the kind of assumptions that the assessor, the human assessor, might have the kind of implicit assumptions, implicit bias. And the idea is that, okay, well, an AI system will not have those human bias and go beyond that, could help going beyond that and to create like fairer decisions. But of course, what has been now it's been clear is that when AI is fed by biased or with biased data, it will reinforce and exacerbate existing inequality. So if you put some people say you put garbage in, you get garbage out, well, meaning that it really depends on the type of data. And the point is that some of this data, as we'll see, are biased at the origin. And so those kind of human and societal bias and assumptions that we have are propagated and exacerbated through the system. So this is, for example, one examples of bias in sampling data and how they raise issues of justice. So the question is, who is represented in the data set? And UK Biobank is an example of it, where there have been like a lot of studies showing so UK Biobank is a volunteer-based study where that collects lots of like different type of data from kind of UK populations. And it has always presented as a great examples to work, for example, issues of genetic epidemiology or like epidemiological issues in general. But what is interesting here is that what has been noticed now for quite a while is that the participant individuals are rarely representatives of their target populations because there are kind of this that kind of volunteering sampling bias, where individuals entering the UK biobanks are more likely to be older, female, or higher socioeconomic status. So why is this an ethical issue? And it's not just like a methodological or scientific issue, because of course it raises the question of whose health are these studies studying, and whether we can apply these results really like globally. So the questions of who benefits, for example, from these interventions. And these are questions of, how inclusive, for example, how inclusive the research is, and how we allocate research resources in an equitable way. Another example is those implicit biases that are in the training data. This is, for example, like there are a lot of studies done using face data sets, and what has been not, as a matter of fact, they use kind of existing data and are often like celebrity data, and they say this database can contain age, gender, and ancestral origin biases. For example, female celebrities tend to be younger than their male counterparts, and this is not data about the population. This is data. Doesn't represent real world, but it represents the movie business. And it's not just, again, about how accurate and how robust the model that is trained with these data sets is, but it is also about how how this can bring to gender bias predictions that will discriminate against people. So the question is, AI reproducing existing inequalities and cultural biases? And is there risk of discrimination of specific bodies and identity that is propagated through this system? What I found interesting last week when I listened to Katerina, your last name got cut off the slide. So she presented on the project agenda, accelerating solutions for global epilepsy with novel diagnostic apps, and specifically on using deep learning for epilepsy diagnostics, the model that she developed. What was interesting is that the data that she was working with is EEG data, which is usually accompanied by a doctor's notes, including patient information, and this was used to derive the labels. But there's not only that, all it really depended on the information. So how the data was labeled really depends on information that was available there, that the doctor had there. And so again, about reproducing human bias through that are present in a data set. But also that, for example, there was no even distribution of ethnicity in the data set. And what was interesting is that she mentioned how they were adding new data sets in order to make the model more representative and to improve the quality of the data. But what I found also interesting is how she's talking about this project ethnographically. The primary goal of the project was to use kind of an ethnographically grounded methods. And the point was, okay, they will not just develop these tools and have them use in a low middle income setting, but they were actually involved with people local communities and working there. And when working there, they realized that a lot of the things that they were developing just didn't quite work. And I think this is an important, especially when working with kind of this predefined data sets and so on, having kind of this reality check sounds like kind of a really key aspect. Another challenge that I want to throw in here is that aspects of responsibility and accountability. That is about the attribution of, so basically who should be held responsible when things go wrong. Are they the designers of algorithms, the users of the algorithms, or the algorithms themselves? And the fact that there are multiplicity of actors And it makes it like usually like very difficult to establish who is responsible for what, and define responsibilities and blame. And this is, for example, was clear in this other project that was presented last week about improving maternal health outcomes in Kenya using AI by Jacaranda Health, where they had this prompts natural, tool using natural language processing to basically red flag. So they would receive like a lot of queries from pregnant peoples and text, and this natural language processing would help determine, like label and red flag issues in order to basically give them determine a priority, whether it's urgent, moderate, and low, and then based on that would also take some actions, whether it is about sending a text in the case of low or moderate to give advice, or alerting clinical professionals to actually provide support. Now, the question is, what happens? How do you account for mistakes in red flagging questions? How do you account for unintended behaviors of users or care providers? So if the system, the clinical profession is not alerted, who is the system was not alerted? Is that the person is not alerted? Is what was that didn't work out in the pathway, and whose responsibility is that? So and yeah, so these are these are questions that stay there. And what I found interesting in this project is how basically I didn't ask a specific question, so I cannot answer this specific question for this project. But what I found interesting, which is I think also like a way to address these questions, one of the ways besides like a bit more complicated kind of legal discussions, is to basically address these issues of accessibility and inclusivity. And what I mean with that is that what this project with this Jacaranda help really showed was to how they were very sensitive to local languages and slang. They were including users in the designs of the responses. They were partnering with local infrastructures and so on. And this was as much part of the process as it was the kind of the training of the algorithm and the training of the model. And I think this is key, because this is how this will not help in defining exactly accountability and liability, but it will be key to ensure to basically reduce the risks, and it will be key in order to assure it is a way to show kind of like responsibilities of and the awareness of the responsibilities of the developers towards this kind of potential and broader risks. The last point that I will just make before closing is this aspect, is the challenge of environmental sustainability. And I'll just put it here. And I know that the last speaker might go a little bit, we will also talk about that. I'm putting it here because it's something that is not often recognized as a moral or ethical concern. But we are aware that there are like a lot of very high emissions that are generating when training AI models, and especially LLMs. And we have lots of studies showing how the process of training the model emits like very high carbon dioxide equivalent emissions. And why this is a moral issue? Well, because basically in the context of developing AI interventions for global health, we need to, there is a kind of this internal contradiction between the goal of improving health conditions and the environmental health impacts and health risks that are due to their environmental impact. So in a way, if people committed to health and committed to improving health, especially in a global context, are kind of kind of bound also to um, a commitment to protect and reduce environmental impacts. Um, and in this respect here, I'm just like putting a link to a newsletter that we have that we are putting together for people who are more interested in these issues at the intersection of sustainability, health, AI, and digital technologies and the environment. As I said, this is like somehow new topic in the context of ethics of AI, but there is a lot going on, and I just wanted to point your attention to that. So let me just come up with some concluding remark. I'm aware I'm just kind of raising questions and not really proposing any solutions here. I'm doing this because I know that the speakers after me will be a little bit more concrete in also providing solutions to these questions. But I'm also doing this because I think it is important, especially when thinking about ethics of the raising questions and showing the problem, being aware of the problem is as important as is important part of generating awareness, is important part of creating kind of a responsible ecosystem, AI ecosystem. So, and it helps in assigning solutions, really trying to understand, okay, what is the challenge at stake here? Why it is a challenge? Why it is a moral issue? What are the different ways we could assess this issue? And that's why, in a way, yeah, I think the raising question is as legitimate as presenting solutions. All right, thank you all. I don't know whether we're doing the questions now or later, but
Um,
yeah.
Yes, we'll do. I think just for the sake of time, we can probably answer one of the questions from the Q&A now, and then the other two. I see there's two other good ones. Maybe you could hop into the chat. So, but thank you. That was a really great presentation. I'm really glad you actually ended off how you did, talking about raising more questions instead of proposing solutions, because there is one question in the Q&A that has asked about the bias that is often baked into training data.
Mhm.
But there aren't. Are there standard methods, kind of in your opinion, to mitigate that? Because from my own knowledge, I know there are computational methods. For example, if you know that a certain population group is underrepresented in your training data, you can force whatever model you have to
Mhm.
either weight them heavier or oversample so that you're kind of balancing the population that way. But I guess in your opinion, are there other mitigation strategies to try to, if not eliminate bias, minimize it as much as possible?
Yeah. Um, Yeah, as as I'm thinking, there are different ways of doing this, and there are entire projects. That's the one that I also had a link on, like the faces, like really thinking about, okay, how do we train algorithm, especially when we use like real world data and kind of available data. How do we do this? So some of these are very complex approaches, which are probably like not best placed to discuss. But from my experience, and I know that sounds like a little bit, it's not as sophisticated as your kind of other approaches, but I think it's still very much in need, especially like from my experience when working within this project, is that is really like to ask the question. So what I appreciated, for example, like when Katarina was talking last week about her project, was kind of this awareness and of saying like, listen, what are the projects? So a few years ago, people will, just maybe either ignore the problem or like just like address it from the scientific point of view, or saying like, okay, then our answers are kind of just like narrowing down the type of answers that you can give. What I think is important is, again, like to kind of recognize this problem, um, and um, and yes, kind of thinking about how to address it. So I know it's yeah, I'm not giving like it's a very sophisticated kind of solution to this, but it's the point is that every project will have this bias, and I recognizing like what of this bias can have consequences on people and impact people and create discriminations and so on beyond issues around the accuracy and robustness of the model and the findings.
That's really helpful. Yeah, thank you. And as you said if there's garbage going into a model, there's often garbage coming out of the model. So it is really important to keep all that in mind. I see there are some more questions kind of in the Q&A. Somebody has raised their hand. If those with raised hands, would you mind adding your questions to the Q&A chat? And anyone who's put it in the chat instead of the Q&A, just add your questions there, and we'll try to answer as many kind of in the chat, the Q&A box as possible, but we can move on to the second presenter now. Thank you so much, Federica. We'll hand it over to Evangelina Baca now, who's our second presenter. So thank you, guys.
Thank you, Ashna. Hello, everybody. I am Eva. Let me share my screen. Perfect. So you will allow me actually to turn off my video because I have some bandwidth issues today and I don't want to cause any further problems. So I am Eva. I am the responsible AI manager at Health AI, and I am also a lecturer at the University of Geneva. And today we will discuss international laws and policies on AI for health and how these affect the national regulations and national strategies on AI. So we will have a brief introduction, then we will discuss the landscape of AI regulation up to 2024. Then we will discuss the WHO AI ethics recommendations and AI regulatory considerations. And then we will have some conclusion remarks. So before starting, I would like to ask you to take some seconds actually to just fill this poll with two simple questions. The first one is, how would you rate your awareness of regulatory guidelines for AI in health in a rating scale from 1 to 5? And the second one is, how would you rate your understanding of regulatory processes to comply with AI healthcare regulations? Again, in a scale from 1 to 5. Okay, thank you very much. So let's start. First of all, in the rapidly evolving landscape of healthcare technology right now, the AI stands at the forefront, let's say, of innovation. So this integration of AI into healthcare domain raises some complex questions in several domains like ethical, legal, social, which actually necessitates robust frameworks of international laws and initiatives to govern its use. So another key point here is that actually this rapid advancement of AI technologies outpaces the current regulatory frameworks and the necessity of updated regulations to ensure safety, privacy, and ethical use. So with this presentation, we will delve into the landscape of global efforts aimed at establishing these ethical standards and regulatory guidelines for AI in health. And the objective of these international laws and initiatives is to create a harmonized and effective regulatory environment that can support this innovation while in the same time protecting individuals and society. So here you can see a graph of the AI market size per region with a forecast up to 2030. And you can see the increase of AI, especially in the North America, which actually highlights the need of regulating this use of AI. Here we have a map with a number of AI-related bills passed into law by country from 2016 to 2022. You can see that the #1 player in the field is USA, and we will speak a bit more about this later. But what I want to highlight is that, as you can see, there are some countries, and especially in Africa, where actually we have insufficient data to extract the insights from. But overall, you can see that globally, the landscape has changed a lot from 2016 up to 2022. So here we have a map with countries having released or developing national strategies on AI. This is a map of 2022. And you can see that actually, again, there are missing data that can actually help us have insights for specific countries. So let's see how, in general, the world is responding to these challenges through international laws and initiatives. So first of all, let's speak about Europe. The European Union actively seeks to shape global norms and standards for AI ethics and regulation, engaging in international forums like the G7, G20, OECD, and the Council of Europe. One key project of the latter is the GAHAI, which is the ad hoc committee on AI, which is exploring the feasibility of legal framework for the development, design, and application of AI. Based on a Council of Europe's standard. So the main initiative right now in Europe is the EU AI Act, proposed by the European Commission in April 2021, and it is actually a pioneering piece of legislation. The European Union has also proposed the AI Liability Directive and the Product Liability Directive, with which individuals will be allowed to claim compensations for damage caused by any kind of AI-enabled product or software. So we have Spain, which is actually one of the first countries to put in force a governmental action for AI regulation. We have EMA, which is the main existing regulator for regulation and supervision of the pharmaceutical sector within the European Union. And as AI and machine learning technologies increasingly intersect with pharmaceuticals and healthcare, the AMA's role right now in regulatory actions becomes highly relevant. And then we have the GDPR, on data protection and privacy for AI systems that process personal data, and the EDPB, which is actually an independent European body that contributes to the consistent application of data protection rules throughout the European Union. So regarding the UK government, in collaboration with the British Standards Institution and the Alan Turing Institute, has been involved in developing ethical frameworks and standards for AI. In March 2023, the UK government published the AI white paper, which proposes sector-specific oversight of the development and use of AI, alongside empowering existing regulators like the ICO, the FCA, CMA, and Ofcom. For example, the ICO has published its guidance on AI that sets out how organizations can apply the GDPR principles to AI development and deployment. Moreover, in November 2023, the AI Safety Summit took place in the UK, where the UK AI Safety Institute, as they call it, the Institute, was formed and tasked with testing the safety of emerging types of AI. And then the MHRA is the main regulatory agent who is responsible for regulating all medicines and medical devices in the UK. So in North America, and let's start from the big player, which is the US, we have the President Biden's executive order, which sets new standards for AI safety and security. We have the NIST's focus on AI, which released the first version of AI risk management framework recently. We have the HHS, which on December 2023 issued its first rule regarding the use of AI in healthcare. We have professional societies and ethics boards like the IEEE or the APA, which have developed guidelines and ethical standards for the use of AI in clinical practice and research. And last but not least, the biggest regulatory agent, probably the FDA, which provides guidance on AI and ML-based medical software, as well as approval of AI-based devices. Then in Canada, the main initiative right now is the AI and Data Act, which is a proposed legislation that takes a principles-based approach to the regulation of the AI development. The Standards Councils of Canada and the OPC, which oversees compliance with the PIPEDA, which is the Personal Information Protection in Electronic Documents Act, if I'm not mistaken, which governs how private sector organizes, collects, use, and disclose personal information in the course of any commercial activities. And then in Canada, there are also several big research centers which are contribute to this direction of research for regulating the use of AI. Then in Mexico, we have a proposed law for ethical regulation of AI. And then in South America, we have three main players, Brazil, Chile, and Peru. Where you see the blue color is actually draft laws or policies, and the lighter blue or greenish, it's legislations who are in force. So you see that the only actually country which has a legislation in force is Peru, with a law that establishes the national authority to supervise the use of AI. In Asia, China is the biggest player, which has launched a number of specific regulations in force or draft. And the main regulatory agents right now, you can see it in blue, it's the MIT, the SAMR, and the SAC. In Japan and in India, there are only draft legislations for now. And in Singapore, in Korea, again, we have no regulatory framework, a specific regulatory framework, but proposed legislations and guidelines for organizations. So in Africa, actually, there are some Pan-African initiatives like the Smart Africa, which has engaged in discussions about the digital economy strategies that could encompass AI governance and ethics. And moreover, while there is no comprehensive continental framework for AI, the African Union's digital transformation strategy is in place and highlights the role of digital technologies, including AI, in Africa's socioeconomic development. And although in general it is unclear exactly how many African countries have formally instituted regulation on AI, there are some data regarding countries that have launched regulatory frameworks or data protection laws, such as Rwanda, Kenya, Ethiopia, Egypt, and South Africa. And well, before passing to this question, there are also still Middle East and Australia and New Zealand but I would never have the time actually to present all the regulatory frameworks existing right now. But also in Middle East, Australia and New Zealand, there is no voted regulatory framework. So I would like actually to discuss with you this very interesting Government AI Readiness Index of 2023, developed by Oxford Insights, which responds to the question of how ready is a given government to implement AI in the delivery of public services to their citizens. And without surprise, you can see that USA is the first player out of the 10. And then we have Singapore, UK, Finland, Canada, France, Korea, Germany, Japan, and the Netherlands. Here, I would like actually to mention that this index doesn't really touch the aspect of having or not having established regulatory frameworks already, but more if there is the infrastructure and the activity inside countries of actual supporting the implementation of AI frameworks. So now WHO in the last during the last 2 years has launched 3 guidance actually. One on AI ethics and governance. The other one and most recent one is on regulatory considerations, and another one on AI ethics and governance, but focused on elements. So I will start with key ethical principles for the use of AI for health. I will not stay in definitions and terminology because Federica earlier also covered some of these, and I know that during the previous session also you had also some insights on this aspect. So there are 6 main ethical principles, based on WHO guidance. And this is, first of all, protecting human autonomy. And by that, we mean the requirement actually that any extension of machine autonomy should not undermine human autonomy. The second one is the promotion of human well-being, human safety, and the public interest. And this means that AI technologies should satisfy regulatory requirements for safety, accuracy, and efficacy before deployment. And measures should be in place to ensure quality control and quality improvement. The third principle is the ensuring transparency, explainability, and intelligibility, so that AI should be intelligible or understandable to all developers, users, and regulators, satisfying both factors of transparency, meaning that information should be published before the design and deployment, as well as explainability, meaning that AI technologies should be explainable to the extent possible, of course. Fourth principle is fostering responsibility and accountability. So actually humans require clear, transparent specifications of the tasks that their systems can perform and the conditions under which they can achieve the desired level of performance. Fifth principle is ensuring inclusiveness and equity, meaning that AI systems should be designed to encourage the widest possible appropriate and equitable use and access, irrespective of any characteristic protected by the human rights codes like age, gender, income, sexual orientation, ethnicity. And also it should be available for use not only in context and for the needs of high-income country settings, but also in the contents and for the capacity and diversity of LMICs. And developers should also consider the diversity of languages around the world to avoid barriers to use. And sixth and last ethical principle based on WHO guidance is the promoting AI that is responsive and sustainable. So Regarding the key regulatory considerations, it's more consideration and not so much recommendations. Well, it's actually related. So the first one, it's again 6. So the first one is regards the documentation and the transparency, meaning that while developing or deploying an AI system, we should consider pre-specifying and documenting the intended medical purpose and development processes, such as the selection and use of data sets, reference standards, parameters, metrics, possible deviations from the original plan, as well as updates and changes during the phases of development. And this should be integrated under a risk-based approach. The second one is the risk management and AI system development lifecycle approach recommendations, which is actually that we need to consider a total product lifecycle approach throughout all phases in the life of a medical device. And we should consider a risk management approach that addresses AI systems associated risks such as cybersecurity threats, underfitting, or algorithmic biases. The third one is concerns the intent and use, analytical and clinical validation. And here there are a lot of aspects actually to cover. So first one is the provision of transparent documentation, is the demonstration of performance beyond the training datasets through a validation dataset, actually, that should be representative of the population and the setting in which the AI system is intended to be deployed. Then we should consider a graded set of requirements for clinical validation based on risk. And here they specifically mention that clinical trials should be the golden standard for the evaluation of comparative clinical performance and for tools with the highest of risk. Whereas in other situations, we should use prospective validation in a real-world deployment and implementation trials that use accepted relevant groups. And lastly, consider a period of more intense post-deployment monitoring through post-market management and market surveillance for high-risk AI systems. So the fourth consideration regards the data quality. And first of all, this means that we should consider whether the available data are of sufficient quality to support the development of our AI system that can achieve the intended purpose. Then consider deploying rigorous pre-release evaluations for AI systems to ensure that they will not amplify any of relevant issues, such as biases or errors, mitigate data quality issues and their associated risks, and work with other stakeholders to facilitate the sharing of good quality data. The fifth one regards the privacy and data protection. So privacy and data protection during the design and the deployment of AI systems. And here is really important. Actually, the key point is that we should have a good understanding of data protection and privacy laws early in the development process, ensuring that this process actually can meet or even exceed the legal requirements. And then we should consider implementing a compliance program that addresses risks and develop privacy and cybersecurity practices. And the last consideration is on engagement and collaboration that can be facilitated mostly through accessible and informative platforms. So let me also put here some conclusive remarks highlighting actually the main challenges that countries are currently facing in their efforts to develop national AI strategies and integrate AI regulatory frameworks. And I saw also some of these points to be raised in the Q&A before. So the first one, I would say it's the resource constraints. As many countries, and especially those in low and middle income contexts,
Thank you so much, Eva. That was a really,
Thank you
really
very much.
interesting presentation. While the second poll is going, maybe we can ask one really quick question and then leave you to answer the rest in the chat. So towards the end of your presentation, you had noted sort of balancing innovation with regulation, which I think touches on one participant's question about how you would go about implementing AI in a country where there are really strict data laws in terms of, sharing the data potentially outside of the country, or even there could be laws about sort of data collection. So how do you balance maintaining those laws or abiding by them, but also trying to enable AI innovation?
Well, for me, the key point here is actually the collaboration between the people who forms these laws and the people who works in the development or design or deployment of any kind of AI system. So in order to ensure that actually uh, the laws are pictured, are portrayed correctly into the AI systems, but also the needs of the AI systems are portrayed into the laws. There is a need of direct communication between the researcher or innovators and the legal people, let's name them like that.
Mhm.
But this will change once the international standards will be on board, and this will probably be during 2025 by WHO, WIPO, and ITU. And we hope that this will change and enhance actually the landscape of regulation globally.
Mm. That makes sense. And just briefly before we pass it on to the next speaker, for the two polls, will the results of the polls
Yeah.
be shared with the presentation materials?
Uh, it could be. Why not? It may be of
Okay.
interest.
Just thinking, I'm not
Yeah.
sure if the participants can see the results the same way we can, so that could be
I'm not sure right now they can, but
yeah. But anyways, could be interesting. But I'll encourage
yeah,
others who have their hands up or who have other questions to post
yeah,
them in the
yeah.
Q&A chat. Meanwhile, we can move on. Thank you so much, Ava.
Thank you.
And
Thank you very much. Thank you.
thank you. I'll pass it on to Henry, who's our last speaker for the day. So thank you. Take it away.
Okay, thank you, Ashna. Thank you very much for the opportunity to make this presentation. My name is Henry. I'm with the Responsible Artificial Intelligence Lab at the Kwame Nkrumah University of Science and Technology. So I'll basically be talking about what we are doing in the lab with regards to a framework for responsible artificial intelligence as assessments that we have. So, I don't know. I'll be talking about why I think AI should be responsible. Then we look at these responsible AI considerations, specifically looking at fairness and equity, accountability, social and environmental impact. We also look at transparency and explainability. All these things, some of the other the previous presenters hinted on them, but the focus of this particular presentation is to look at or to look in the direction of self regulation. So basically, emphasis is going to be on the developers and how we could work together or try to incite interest in making sure we do the right thing. So we'll look at the responsible AI pipeline, which is one key thing, together with the considerations which are used to help design the facets responsible AI framework that we'll be talking about at the end of the day. Yeah, so basically, we want solutions that actually respect people in terms of being equitable and also having a high sense of integrity. And if we want our AI solutions to have these qualities, then we have to make sure they conform to some standards and some frameworks. So in the AI space, we have the ISO 26000, and we also have other frameworks like the FAT, the FATE, the facets. Facet is what I'll be talking about at the end of my presentation. And when we tend to adopt these standards or frameworks to govern how we work or how we come up with our innovations, they tend to improve the trustworthiness of the system, like the trust that people have in the systems that we have. So how can we make sure that, okay, the systems that we put together are responsible? We have to make sure that we've considered fairness. We've also considered accountability. The issue of equity has also been looked at. For data and privacy issues, we've also considered them. Then when it comes to transparency, the previous presenters spoke about explainability. Frederica spoke about explainability. Ava also spoke about explainability and all that. It's something that you have to look at, and also its impact on the society and also the environment. There are also things that you need to really look at. And in terms of safety to the users of the system, how robust is your system and all that, there are things that you have to look at. So when it comes to fairness and equity, we encourage the real-time analysis of these AI systems, so that at least we should be able to identify intentional and unintentional biases. Because once you have a system that is biased, it's not going to help people within the society. One thing that I would say, simply put, if you are asked what makes something responsible, I would even say that you are making that particular thing to be safe for use. And if a particular group of people are disadvantaged by virtue of your system being in existence, then it becomes an issue to be looked into. So that is why at least you have to continuously monitoring your system to make sure that you identify some of these issues and try to mitigate them as early as possible. I think with the issue of accountability too, we also have to make sure that everyone in the development phase is responsible and accountable for whatever actions that come out of the system that is being developed. I think is it Eva was made mention of instances where people are questioning who is supposed to be responsible or accountable. Is it the algorithm? Is it the human being that is developing it? But in this case, we'll say that it is the human beings that are developing it, because the algorithms are put together by human beings, and they reflect their intentions and their values. And so with that in mind, the human beings or the developers that are coming up with these algorithms are supposed to be held accountable. In as much, by extension, the organizations that they work with are also responsible for whatever comes out of these systems. And one nice thing too is there are a lot of companies, for instance, like Ava's company, the Health AI, they are coming up with responsible AI desks, offices or units, so that at least within companies, they can help ensure that whatever work that they come up with conforms or adheres to some set levels of fairness, or have some ethical considerations when it comes to their solutions that they provide. So all the policies that the company or these organizations have, they should be very clear and accessible to these developers that work on the systems on a day-to-day basis. And in so doing, they would try to conform to the policies or the frameworks that have been adopted by these organizations and work within the confines of whatever the values of the company. Let me put it that way. And the other aspect when it comes to the social and environmental impact, we'll see that I'll start with a quote from the IEEE Global Initiative on Ethics of Autonomous and Intelligent Systems. you realize that it says if machines engage in human communities as autonomous agents, then those agents would have to follow or will be expected to follow the community's social and moral norms, which is a necessary step in enabling machines to do so, will be to identify these norms. But whose norms? So basically, these norms would be the cultural practices of the community or the country where your solution is supposed to be used. You have to try and embed the values of the people in there, because if you don't do that, there's the tendency of affecting acceptance of the people within that locality. And how can you do this? You can also do this by making sure that you co-create the solutions, you involve them, you try and get in policymakers, you try and get in academics from these environments so that at least they can help you have some other perspectives of the solution that maybe you wouldn't have considered. And one very important thing too is that mostly we might have to align our solutions to some ethics canvas, and these ethics canvas basically should be localized or contextualized in the deployment areas. And when it comes to the environmental impact too, what I would say is that it's often overlooked. Yes, but that is a very important aspect too, because everyone is talking about climate change, global warming and all that. So what is the impact of our algorithms on the environment? The time that it takes to train our algorithms, right? How much fossil fuel is being burnt to actually help these models to be trained to get to a level where they can be deployed into the communities to even do the good that they have to do eventually. But before the good is done, some bad will have happened in the process. So how do we try and optimize these things? There's a good tool out there, we call it the Code Carbon. So Code Carbon can help you estimate the amount of emissions that you'll be making in trying to train your models. So these are things that at least can help in trying to make sure that our algorithms do not really have adverse effects on the environment. The next thing that I'll talk about in terms of considerations is the transparency and explainability. A lot have been said here. So all that I would say is that imperceptible AI is not ethical AI, because we are getting to the point where now AI is able to do so many useful things. It's becoming very impactful, but we have to consider its adoption. And once it's given or taking part in very, very important decisions, you need people to wholeheartedly accept it and also decide what go with the decisions that these AI systems are giving out. And as other speakers have mentioned, if you do not provide the reasons behind the inferences that are going on or the decisions that are going on, it's very difficult to do that. There are tools available that at least, and also practices that can help us to ensure that we enhance how explainable our models are and also how transparent our processes are. One very important thing, it looks like everyone's talking about data, privacy, and all that. Yes, it's very important. The data is gold, but you don't have to bully people into giving you their data. Yes, you need to also realize that users are the owners of their data, and they can decide to give you the data or not. And that's they maintaining control over their data. And the fact that in an instance where they decide not to give you the data, that should not deny them access to the use of the service or the use of the system. Yeah, so often we tend to see that you visit certain websites or try to access certain services, and if you are not accepting some cookies or accepting some terms, it becomes very difficult to use these services, and it's not a good practice. And as people who are trying to come up with solutions that are responsible, we should try and respect the privacy of our users, and also try and protect the data of our users. Yes, how do we protect the data of our users? Making sure that we prevent them from thefts by ensuring that there are some security mechanisms that we've put in place to be able to ensure that the security of the data that we are storing, of our users that we are storing, is of the highest form of integrity. And there's no issue of data corruption. And okay, then I think the last side, last consideration will be the safety. So how robust, how secure is your system basically, and how safe is it for use? All these things at times they come in during your envisioning stage, when you are even designing the solution, you are designing the problem. Sorry, the solution to the problem. You have to do it in such a way that, okay, even when unforeseen events happen, the device or the system should be self-healing, self-organizing, so that it doesn't have any adverse effect on the users of the system. So that is also one very important thing. And we should have a risk management system in place, so that at least we should be able to use that to avert any risk, that potential risk that might affect the system. So when you look at the entire pipeline, development pipeline, we've tried to break the development pipeline into 4 different stages. That's the first stage is the envisioning stage. The second stage is your data stage. That's where you deal with your data collection, data cleaning, data processing, all those things happen at that side. The model phase, where you are coming up with your model architectures and training of your models, and all that has to do with coming up with what a good model, a usable model. Then the final stage, which has to do with deploying your model. So the entire pipeline is broken into these 4 stages. And some questions are asked, certain things of interest are asked based on the considerations that we've seen earlier. And during the envisioning stage, which is basically the planning stage or the project planning phase, questions that are asked: which stakeholders are you working with? Have you identified stakeholders? Because I already mentioned that some co-creation, when you co-create, you tend to, at least in a way, prevent certain things or identify certain things that you would not have identified, which might cause problems in terms of some biases and all that in the future. And here, are there any algorithmic biases that you envisage? And what is the societal impact in terms of impact on the society? What's the impact on the environment? And if you have some policies available in your company, how do you ensure compliance, so that at least you know that you are adhering to some local policies, even if they are national policies or international policies? How do you make sure that you comply? So those are considerations or questions that we tend to ask at the envisioning stage during the planning phase. Then when it comes to the data side, we tend to look at, okay, everyone is now talking about sharing, data sharing, open data. So we try to find out, is the data open? Is the data closed? Do you have any serious issues when it comes to your data? The transparency is the process of even coming up with the data sets that you have, how transparent was the process. So that at least, because once the process is transparent, people can have some high level of confidence in the data that you have even made available for others to use. And by extension, you can also improve the confidence that people have in the solutions that you are coming up, or the solutions that arise from the data that you collected. When it gets to the model stage, things that are of interest to our framework or the
Hi,
facet
Henry. Could I interrupt you just for 2 minutes? Just to let everyone know that even though we are technically supposed to end in another minute, if folks can stay on until about 2:40 UK time, so another 10 minutes or so, that would be great. That would give Henry a chance to finish his presentation and answer any important questions. So thank you all. And sorry, Henry, go ahead.
Okay, thank you, Ashna. So at the model stage, is your model dependent on any technology? You want your model to be very versatile. It shouldn't depend on some technology, a specific technology, which would force people to actually have to invest in those type of technologies or new technologies. In terms of your parameter tuning, in terms of your documentation of your models, and also the carbon footprints that I mentioned earlier. At the deployment phase, you're looking at the societal impact again, whether you are considering any active learning phase so that you are able to orient the model, even whilst in deployment and all that. We're also looking at the inference reports and also confidence scores. Confidence scores, once they are reported, it's a very good indication of or indicator for people adopting or accepting your solution. So here, the facet basically was designed in Ghana with two other collaborators, one from Burkina Faso and the other from Tanzania. So basically, we make up the AI4D Africa Labs. We came up with a framework so that it can help us promote and also objectively measure the solutions that come out from our lab. But we are opening the framework up so that at least anyone at all can use the framework in their own solution, and also use that to help us to improve moving forward. Yeah, so it covers the pipelines, as I mentioned, and these are the evaluation sections that we consider. We look at the AI fairness assessment, inclusive design, sustainability, how if you've considered scaling, even commercialization of your AI solutions, all during the envisioning stage. And for the the model and the deployment phases, the focus is more on the ethical and the responsible implementations of things at those stages. We've tried to compare the framework with other frameworks, and it looks like our framework looks at all the pipeline, all aspects of the pipeline. That's from the planning all the way to the deployment. So what I'll do is I'll stop sharing and we can all visit this link if we have the time. That's facets.netlify.com. We've tried to host the framework online, which everyone at all can have access to, and use that to help check how responsible your solutions are by just answering some questions that are posed in the online software. So I'll just stop sharing and share the link. Yeah, so I think this assessment is an assessment on the epilepsy diagnostic tool by Katarina et al. And I think from when you visit the site, basically what you have is you have these stages, the four stages of the pipeline, and at every stage you have the facet basically means the fairness, accountability, confidentiality, ethics, transparency, and safety. Those are the considerations that we are looking at and for this particular framework. So all the questions that are asked, you provide answers to them. And as you answer the questions, it's scores automatically. It scores automatically. So you get to see your score, how you are faring. So for instance, in this case, for envisioning, let me change this back to what you received from Katarina. For envisioning, you realize that under the envisioning stage, fairness was 100%, accountability was 100%, confidentiality was 100, ethics was 61, transparency was 100, then safety was 100. Then under the data, you realize that based on the responses from Katarina on her project, fairness was 100, accountability was 100, confidentiality was 0 because yeah, that was 0. Ethics was 100%, and transparency was 80, safety was 67, confidentiality was 0 because it looks like they are following more of an open culture and not keeping data to themselves. So that's why the confidentiality part is that. And at the model phase, you have the fairness was 40%, accountability was 53%, confidentiality of the model was 100%. It means that for the model, even though they've trained the models, they are not sharing, they are not making their model publicly available and all that. So it means that here, a lot of things are very confidential. They are not sharing, unlike the data where they made use of open data. And in terms of ethics, we had 57%, transparency, 62%, safety was 53%. And for deployment, I think the response that came, she really did not know since she was not part of the deployment team. Yeah, so that side, you realize that for the deployment, you're getting 0% for everything. This line is supposed to be an aggregation of all the things that you see here because deployment is 0. You have an average of 0 here. For the model, you have all this averaging to 57. For the data, you have all this averaging to 97. And for the envisioning stage, you have all of this averaging to 85, which also averages and gives an overall score of 62%. And one nice thing about this, the framework, is that it has a badge. So as you answer the question and all that, the badge is also being updated. And at the end of your assessment, you can just click on the badge, and that is the badge. You can export the code of the badge and put it in your application anytime that you want to ship the application out. You can also download the reports using the download button that you have here, which gets your project name, the evaluator name, and the comments, any comments that you want to use. So this is just a brief overview of the facets framework that we have. And I think I would end here and open to receiving questions from the audience. Thank you very much.
Thank you so much, Henry, for that great presentation. I think that was particularly interesting to see for those who were here during the first session to see how one of the topics there scored in this. And I would encourage everyone to visit this link. It is available in the chat for folks to visit. Given that we only have 2 minutes left, I'll let, if possible, Henry, could you answer? There's one question for you in the Q&A. I'll meanwhile just quickly share my screen again, and we can just go over the certifications again. Here, let me just go full screen. So here, this is the link to certification. If everyone can see that, as mentioned at the beginning of the session, if you wish to receive a certificate, you either you have to have two requirements: completing the TGHN workshop feedback survey and 80% attendance of the workshop. There was a question towards the beginning about whether or not you have to attend both workshops. So certification is happening for the two separately. So last week's certificate will be separate from today's certificate. And here is on your screen now, you can scan this for the post-workshop feedback survey. So you have to have attended 80% of the workshop and completed the survey in order to receive a certificate, and those will be emailed to you in about 1 month. And it's important to include the title of the event and the code that you see on the screen. And yeah, with that, I thank you all for attending. Thank you so much to the panelists for presenting. As folks have been saying in the chat, all the presentation materials and the recording will be available on TGHN's online platform shortly. And I see Louise just posted it again. So keep an eye on that link, and the materials should be available to you soon. So I'll close the session there, and thank you so much for your patience. Apologies again that we ran over time. And I hope everyone has a lovely rest of your day. Thank you all for joining.